I'm Lyndsay Rice. This is Levi Rice. He's 4.5 years old and we live in Caledonia, Michigan.
And I'm Lisa Lauber. I'm a pediatric physical therapist with Spectrum Visiting Nurse Association.
Levi was born at Spectrum at 38 weeks and 6 days. Full term, he looked healthy, 7 pounds, 9 ounces, perfect. And then we sent him off to the nursery and his nurse noticed that his fingertips and his toes were blue. She called in the pediatrician and the pediatrician called in the neonatologist. And they were running some tests and it took a couple days to figure out, and it was actually Dr. Lee at Helen DeVos pediatric cardiology that did his echo on his heart, and we found out that he has hypoplastic left heart syndrome. Essentially the left side of his heart didn't grow, and so at the time when he was born 4.5 years ago, Spectrum did not have a surgeon that could perform the surgery, so Dr. Lee suggested that if we wanted to do the surgery, that we go to Ann Arbor. He was survival flighted to U of M for the first of several surgeries. He was in their PCTU for 32 days and he came home. And that was the end of April in 2012. In July, his shunt clotted off, and we went back to DeVos. The ambulance took him to DeVos, and Dr. Lee came right to the emergency room, his cardiologist, and said, we're gonna take him upstairs, we're gonna figure out what's going on. They ended up putting him on ECMO, which is basically a life-saving device where the machine does all of the work of your heart and lungs. So he didn't have to do any of that work, but they connected him in his neck to ECMO, and realized that there was a blood clot in that shunt and he would have to have open heart surgery again. So then they helivaced him back to Ann Arbor in July for that, and then we were in Ann Arbor for four long months. And then the time came right around October that we had pulmonary come in and do some tests, and they said yes, he needs a trach. His lungs he just keeps collapsing. He's not going to be able to breathe without a trach. So we had another open heart surgery. We put in a trach. We put in a GJ feeding tube because he at that time had reflux so horribly bad that he had failure to thrive. He couldn't keep anything down. So we put in a J tube so he could get his nutrition right into his intestines. And a month after that or so, we came home. Probably around his first birthday, 1.5-year birthday, is when his pediatrician said, I think he could do some therapy now. I think we can have in-home therapy come and he can start some physical therapy, and he's strong enough now and not quite as fragile. And so that's what we did. We got a phone call from visiting nurses, and that's what started the ball rolling. We qualified for physical therapy and occupational therapy and speech therapy, and Lisa set it all up, and they came out to the house, and we did it for 3 years. But he just keeps going, and he keeps learning, and he keeps growing, and now he walks and he runs and he jumps and actually gets off the ground without falling down. He does. And it's so fun to watch his growth. We're not great at stairs yet. We go upstairs, we don't come downstairs so well yet. But he does it all. And occupational therapy, worked on fine motor skills. He's got such low tone that fine motor skills, grasping and pincher grasps and all those things are very, very hard for him. But without the occupational therapists, he wouldn't be doing well in preschool. And speech therapy, we've got some words. He says mom, and he says dad, and he says go and no. We've got some 2-syllable words. He says yeah.
Yeah.
Yeah, he says yeah. And it's so cute and so fun, and he's so full of personality and life, and it's just so much fun now that he does so much. So that's kind of where we are.